Assalamualaikum everyone. For our class today, we will learn about osteology of the upper limb. So what is osteology? Osteo means bone, logy is study. So we are about to study bone of the upper limb. Why is it important for us to learn about this? It is for us to differentiate whether the bone belongs to the right side or left side. Why? Because, for example, if in the future you are interested in forensic pathology and you were given a bone, for you to identify whether this bone belongs to male or female victim, um, or maybe you were given a set of a human skeleton for you to identify whether you have complete bone of the victim. So you need to know. In order for you to know whether the bone belongs to the right or left, upper limb or lower limb, you need to know the surface of the bone. Okay, superior, inferior, medial, lateral, anterior, and posterior. All these surfaces has their distinctive features to differentiate from one another. Okay. So, okay, I divided this lecture into 4 parts, which consists of pectoral girdle, arm, forearm, and hands. And before we proceed, for those who find that it is easier for you to understand the topic by knowing the term that you are using, so you can go through this glossary, or else you can just proceed, okay? You can go through this slide by yourself. Okay, for the first section, pectoral girdle. Pectoral girdle consists of 2 bones, which are clavicle and scapula. Okay, so the first bone that we are going to talk about is clavicle. Okay, for example, clavicle, even though it is just a small bone, but clavicle is classified as long bone in our body. Okay, what is so unique about this clavicle is that it has, even though it is a long bone, but it has no medullary cavity, unlike tibia or femur. Okay, those bone has capability to form blood cell, but clavicle, it doesn't have this medullary cavity. And the other unique things about clavicle is that it is the first bone to ossify in human body, but it is among the last. It is among the last to complete its bone formation. Okay, so you can determine a person's age by looking at clavicle, ossification of clavicle. Okay, and it lies subcutaneously and horizontally. Okay, in your body, and it situated directly above the first costal rib. Okay, it connects the upper limb to your exoskeleton, this clavicle. Okay, and it made up of anterior, medial, 2/3 anterior convex, and lateral 1/3 of posterior convex. Okay, looks like this. Okay, if it is right clavicle, it looks like this. Superiorly here. Okay, and it articulates medially to your sternum by sternoclavicular ligament forming the sternoclavicular joint, and articulate with scapula laterally by acromioclavicular joint. There's acromioclavicular ligament that connects these 2 bones forming acromioclavicular joint. Okay, and this bone is the most common fractured bone in the body. Function of clavicle: it transmits the weight of the limb to the sternum. Okay, weight of your appendicular skeleton to your axial skeleton. Yeah, and it keeps scapula in position. Okay, so that the arm can hang freely, and it protects the underlying structure. Okay, in our next subsequent lecture, we will learn about what are the structures that lies underneath clavicle. Okay, and um, you can watch the video that I have embedded here, so that you can further understand how the position of clavicle in human body and how to differentiate, okay, between the surfaces of clavicle. Okay, for example here, okay, for those who already watched the video, you may have some idea about how to differentiate the surfaces of clavicle. Okay, as you can see from picture here, the superior part has smooth surface as compared to the inferior part, because the inferior part, it has subclavian groove and also this impression for costoclavicular ligament. Okay, and as I mentioned before this, the medial two-third of clavicle is anterior convex, and the lateral one-third is posterior convex. Okay, so you have determined the anterior part, superior part, anterior part, posterior part, superior aspect, and inferior aspect. Okay, um, and this image here, you can see, okay, the trapezoid line, conoid tubercle, and impression for costoclavicular ligament. Okay, these are the features that help you to differentiate superior and inferior surface. Yeah. Okay. Next, pectoral girdle. Next, scapula. Okay. Okay. As you can see, scapula. You can use anything just to make you understand what we're talking about. This is basically a triangular bone. Okay, that join clavicle and humerus. Okay, humerus, clavicle, and scapula at your back. Yeah, it lies on the posterolateral aspect of the back of the thorax, overlies the second and seventh rib. Yeah. Okay. Uh, Scapula also unique because um, it is almost transparent. This bone is almost transparent. If you can Google an image of CT scan thorax, maybe, okay, like here you can see that scapula, okay, in the CT scan will be like just a thin line of bone, okay, because it's almost transparent. It's a very thin bone, and it's rarely fracture, and the function of scapula is to stabilize other bone that involved in the shoulder movement. Yeah. And it has glenoid process. Okay, but glenoid process that articulate with humerus. Okay, head of humerus, and it has spine. Okay, that project posteriorly, and acromion process located laterally. Okay, the spine, acromion project laterally, and the coracoid process anteriorly. Okay, you can see here, you can differentiate scapula easily because, okay, the acromion at the anterior here, coracoid anterior, acromion posterior and lateral, and it has spine, scapular spine, okay, with, yeah, here, the acromion, okay. For, for the understanding, and you can visualize this bone by watching the video that I've embedded here, okay. This is basically images that I put so that you can have an idea what is, this medial border, lateral border, and superior border, anterior surface of scapula, inferior angle, superior angle, okay, and posterior surface of scapula. You can see obviously the prominent scapular spine here. I don't think you can, confuse to determine whether anterior and superior aspect of scapula. And just remember, the medial aspect of scapula should be straight, okay, because here it overlies the ribs, second to seventh rib, yeah, and this glenoid cavity is obviously supposed to face laterally to accommodate your humerus here, okay. And this image basically just to show you the scapula, even though it's just thin bone, okay, but it has a very important function as a place for muscle, the origin of muscle and attachment of muscle. I think there are about 17 or 18 muscle that attach and originate from scapula. Yeah? Okay, next is humerus. Okay, so for humerus, let's see. Okay, this is your humerus. Okay, this is the head. This is the longest and largest bone of upper limb, and this is the head facing medially. Okay, supposed to be right, kan? Right humerus facing medially the head. It has the anatomical neck and surgical neck. The narrowing part of the head, okay, this is the surgical neck, anatomical neck, okay. It has intertubercular groove, whereby we have lesser tubercle at front, anteriorly, and a bit posteriorly, the greater tubercle, okay. And distally, it has capitulum that articulate with radial head, okay, lateral radius, lateral part, okay. Capitulum articulate with radial head, and trochlea, okay, articulate with ulna, yeah, okay. So of course, if this is lateral part, capitulum and radial head, and medial part, trochlea and ulna, obviously this is the medial epicondyle, and here is lateral epicondyle, okay. You can appreciate these features if you go through the video attached, yeah. This is basically the this is basically what I've mentioned in previous slide, and what has been mentioned by the speaker in the video that I attached in previous slide. Okay, you can see here the anatomical neck, surgical neck, shaft, the radial radial groove here, and etc. Okay, see you in next part. Thank you.